All right, good afternoon, everyone. I'm Christopher Fifley. I'm from the North Dakota Consulting Company, and today we'll be going to the case study of Sawgrass State University and fighting scared of fentanyl. This case has been brought up because there's been a recent overdose at the Sawgrass State University, and today I'll be giving you guys a policy to go by for that. So here's the outline for today. We'll be going over background, main issues, and stakeholders, and then also the ethical, legal, and financial consideration. And then we'll be going to recommendations of the preventive and recovery strategies. So background and main issues. So first, a little campus overview here. So that is the diversity on campus. There's about 10,000 students living on campus. It is a public mid-sized university with around 24,000 students. There's no current drug policy in place and very few harm reduction policies as there is Narcan on campus. And the campus safety is under review by the SSU Public Safety Department at the moment. So the current fentanyl crisis, I just want to give you some background on this very severe crisis. As you can see, from 2019 to 2021, the opioid deaths has doubled, and 70% of those were fentanyl, so about 60,000 of those deaths. Every 8.5 minutes, someone dies of a fentanyl overdose. That is actually a very hard statistic to look at. So just a little bit more data on that. This is the leading cause of death in individuals 18 to 45. As you can see, COVID-19 and suicide deaths double and then barely equal fentanyl. Fentanyl is 50 times stronger than heroin, 100 times stronger than morphine, so this is a very lethal drug we're looking at. The stockholders, so we've got two internal stakeholders being the students of the university, and two externally linked stakeholders being the students' families and the communities around them. Ethical consideration. So there's really an ethical dilemma when you're looking at this, because there are two very different sides that balance very differently. Those being the macro level and the micro level. I'll first go into the macro level. That's talking about the campus ethical values, things like the community, other students who may not be using the drugs, and campus safety. Then the micro level being the individual rights and the autonomy. So looking at each individual student's right and making sure that we're protecting the student's future opportunity as well as their safety. Then the legal consideration. So this is something very important to be brought into the realm because fentanyl is obviously an illegal drug, so are the street drugs that are being placed with it. And then, so first of all, federal law and the Florida statutes. So that's something that you're going to first have to look at, as that is first in line. That is, if they're possession of drugs, things like that, the law deals with that. But towards the college, there can be some legal lawsuits, including wrongful death. I'll show you 3 cases in a second. Police action, so if there's unlawful search and seizures, things like that, that can be a lawsuit. And then campus medical lab control, there's cases I linked right there as fentanyl got out of the lab. So to make sure that security is tight in those labs. So the wrongful death cases, these are all cases filed against campuses. None of these cases did go through, but I just wanted to bring it up to make sure that this is something that has been brought up and something to just look out for as it's a possibility. Financial consideration. So on the financial side, looking at medications, so that's your Narcan and naloxone units, as well as fentanyl strips. Things like labor and the legal consideration. So labor, you're going to have to look at the training costs, things like that. But the training costs for things of like the use of Narcan and naloxone is very minimal at that. And things like the drug recovery program can be produced just from your already existing counseling services. So then on the legal side, the lawsuit settlements, as none of these the wrongful death, none of them have went through, but again, it has been brought up, and some have gotten close and have gone to other bystanders. Police action, just making sure your police force is well trained, so none of this will happen, and they can't slap fentanyl control, mainly a security issue there if it does happen. And then the social, so this is the main point I want to brush on, as things like student enrollment and reputation loss are not a number you can place, but it can definitely put a long-term effect on these campuses, and then as well as community safety. So recommendations. So the harm reduction policy, and it is really a 3-step thing of prevention, treatment, and recovery. So I just want to go over this is an evidence-based approach. Many colleges have done research on this, and it is very good, especially in the mental well-being side of things. It is community-driven strategy. This is meant to keep members of the college together and to help them through hard times. So the well-being of physical, mental, and social is very important and should be important to the college, as that should be number 1 priority, as your students are really who your business is from. So, and then moving on to these strategies that we put in place. So for prevention. So first and foremost, student drug education. So we want to make sure the students are informed of how lethal fentanyl is and how it can be laced and certain things like that. As there's a lot to fentanyl, to make sure that they understand the basis of that. Then training, so making sure staff is trained on how to use Narcan, naloxone. There are many harm reduction services out there that are willing to demonstrate this, as you can have some sort of assembly, things like that. Fentanyl strips, this is to test drugs to make sure there's no fentanyl in them. This is a simple way to just have the students test and make sure that there's no danger, especially with fentanyl, because the littlest dose could be lethal. And then fentanyl control in medical labs. This is very important, as there have been a couple cases where it has gotten out, so making sure the security is very tight there and that nothing is getting out of those labs. Risk reduction and recovery, so making sure Narcan and naloxone is easily accessible. This is very important, as if an incident occurs, there's not much time. So making sure there's things like vending machines or Narcan available at all areas. Then that goes with RA training, make sure RAs are trained, as the majority of the students that you're looking out for will be on the RA's floors. And then the recovery programs and the mental health services. So these are obviously another big thing that you can implement into your counseling services, things like that, to make sure that the students get back on the right track and have a successful future. Here's a harm reduction policy survey they have done. It's a professor from Florida and also a professor from the Midwest that went through this. And naloxone distribution was actually on there, and about 30 to 40% of the students agreed that that was a good idea. So that was just from a small sample size as well. So some research showing that this is working and that the students are actually looking forward to it. So in conclusion, as a campus, you really want to focus on the student well-being, physical, mental, and make sure that you're attaining to that as your students are your customers, and those are the people that you're educating, and those are the people that are going to go out and have a future. So again, make sure that if something like this does happen, there's a strong recovery with those recovery programs, and just overall makes the campus safe again. So thank you.